Students, we have discussed the anatomical features of Pterygopalatine fossa in detail, and now an overview of Pterygopalatine fossa with the help of diagrams. Now, location of the Pterygopalatine fossa, as we have discussed, we can approach Pterygopalatine fossa in a lateral view of the skull, just below the zygomatic arch in the infratemporal fossa. This is Pterygopalatine fossa, bounded posteriorly by pterygoid process, anteriorly by the posterior surface of maxilla, and this is pterygomaxillary fissure. The same Pterygopalatine fossa in colored diagram, bounded posteriorly by pterygoid process and interiorly by posterior aspect of the maxilla. Pterygopalatine fossa is bounded anteriorly by maxilla, supromedial part of the posterior surface of maxilla, pterygoid process, superiorly by the body of sphenoid, and inferiorly, this in blue color we can see pyramidal process which bounded inferiorly, and this is perpendicular plate of palatine bone which we can see through the pterygomaxillary fissure. In this diagram we can understand the medial and lateral boundaries. In this diagram you can see this is pterygomaxillary fissure through infratemporal fossa, and we will enter the pterygopalatine fossa, and on the other end means on the medial side this is a nasal cavity and communicate through it with sphenopalatine foramen. In this diagram we can see the lateral wall of the nose. These are all the bones and cartilages which take part in the formation of lateral wall of nose, and this one in blue color is the palatine bone, perpendicular plate of palatine bone with sphenopalatine foramen. This part of bone forms medial boundary of the pterygopalatine fossa. This is individual palatine bone with the orbital and sphenoidal processes and sphenopalatine notch, and when these horizontal plates articulate, they form posterior 1/3 of the hard palate. Pterygopalatine fossa act as conduit for the neurovascular structures, so it has communications with the various structures, like it communicates with the orbit through inferior orbital fissure. It communicates posteriorly through foramen rotundum with middle cranial fossa, through palatino-vaginal canal with the pharynx, and through pterygoid canal with the foramen lacerum. Similarly with the lesser and greater palatine canals which communicated through oral cavity. Medially it communicates through sphenopalatine foramen with the nasal cavity, while laterally through this pterygomaxillary fissure with the infratemporal fossa. Contents of the pterygopalatine fossa include: number 1, pterygopalatine ganglion. This is also called sphenopalatine ganglion. This is the largest peripheral parasympathetic ganglion which receives 3 roots: parasympathetic root through greater petrosal nerve, sympathetic root through deep petrosal nerve, and the sensory root through maxillary nerve. So this diagram showing connections of pterygopalatine ganglion, how the parasympathetic fibers from the parasympathetic nucleus or lacrimatory nucleus join the facial nerve, and then facial nerve run in the facial canal. At the level of geniculate ganglion, greater petrosal nerve arises and then pass in the pterygoid canal. Sympathetic fibers around internal carotid artery leave as deep petrosal nerve, and it also joins the greater petrosal nerve to form nerve of pterygoid canal. Both reach the pterygopalatine fossa where parasympathetic root synapses and sympathetic fibers pass as such. Sensory root comes from the maxillary nerve through which it is suspended in the pterygopalatine fossa, and then postganglionic branches arise and supply the mucous membranes and mucous glands of the nose, paranasal sinuses, hard palate, pharynx, plus secretomotor fibers to lacrimal gland. Now branches of pterygopalatine ganglion, they are also called indirect branches of maxillary nerve, and please remember that all the branches through pterygopalatine ganglion contain three types of fibers: parasympathetic secretomotor fibers, sympathetic which are vasomotor fibers, and sensory fibers. So these are the branches which arise from the pterygopalatine ganglion. Nasal branches, greater and lesser palatine nerves, pharyngeal branch, and this one is nerve of pterygoid canal, and we can see the ganglion is suspended through maxillary nerve, and then the branches of maxillary nerve. In this diagram, simple version again, the branches of pterygopalatine ganglion. This is a flow chart for the secretomotor fibers to lacrimal gland and how they start at the lacrimatory nucleus and ultimately they reach the lacrimal gland. Maxillary nerve is the purely sensory division, arises from anterior border of trigeminal ganglion, leaves the middle cranial fossa through foramen rotundum and enters the pterygopalatine fossa. Here the pterygopalatine ganglion is suspended through maxillary nerve. Then it leaves the fossa by passing through inferior orbital fissure and continue as infraorbital nerve and finally emerges on the face through infraorbital foramen. In this diagram, we can see the branches of maxillary nerve which arise within pterygopalatine fossa. These are ganglionic branches, posterior superior alveolar nerve, zygomatic branch, and then the nerve itself will continue as infraorbital nerve. Now the branches from third part of maxillary artery which enters the pterygopalatine fossa through pterygomaxillary fissure and divide into various branches which pass through along the branches of pterygopalatine ganglion. And this diagram showing simple pyramidal shape pterygopalatine fossa, its various communications and branches from pterygopalatine ganglion and a third part of maxillary artery. So this was all about pterygopalatine fossa. Thank you so much.